Jim Carrey, Robin Williams, and Edgar Allan Poe all suffered from a bipolar disorder, according to an article in Mental Health Today. But is suffer the wrong term to use? Would Jim Carrey be Jim Carrey had he been a normal individual? Would Robin Williams be able to keep the world in stitches from his comedy had he been on an even keel? Would Edgar Allan Poe have written his famous work, The Raven, with all its eccentricities and brilliance, had he been a normal individual? Would Van Gogh have written one of the foremost painters in the world, had he been mentally stable? There are millions of people all over the world diagnosed with bipolar disorder, with 5.7 million adults diagnosed in the U.S. alone, according to data collected by the National Institute for Mental Health. So does this disease limit one's life? Let us begin by trying to understand what bipolar disorder is. According to Roberta Anderson of the Morongo Behavioral Health Clinic, she described it as shifts in a medical condition which causes shifts in a person's mood, energy, and ability to function normally at school or at work, and in everyday life. It's defined by mood swings that range from overly joyful or manic to extremely sad or hopeless. An anonymous bipolar patient described this illness as exhausting, frightening, and confusing? Oh, there we go. 1 minute you feel like you're on top of the world. Euphoric, exhilarated. You feel like you can do anything you set your mind to. The only problem is you can't set your mind on anything. You race from one project to the next, you rarely finish anything. Then it all comes to a sudden stop. You lose your focus, nothing seems to matter, you lose your drive, and suddenly all you want to do is sit in your room and not do anything. And that was poorly misquoted, and I apologize. You're filled with self-pity, and you want to just hide yourself and your own lack of self-worth from all those who care about you. You go from amazing highs to lows that seem to leave you breathless. You have no control over anything, including how you feel. Bipolar has been divided into 4 different categories: bipolar 1, bipolar 2, and bipolar not otherwise specified, as well as cyclothymic disorder. Bipolar 1 is generally defined by very manic episodes that generally result in hospitalization. Bipolar 2 is much more mild. It's classified by depressive episodes, a majority of depressive episodes, and not otherwise specified is they can't clearly determine it as bipolar. It has some of the similar symptoms, but they're very mild and very hard to detect. And then cyclothymic disorder is very rapid. It's mild, but their emotions are just constantly going from low to high to low to high. And of these 4, bipolar 1 is the most dangerous and prevalent. The National Institute estimated that, or Mental Health estimated that 15% of sufferers will commit suicide. So what causes this dangerous disease? There are many illnesses that coexist with bipolar disorder, ranging from post-traumatic stress disorder, social phobia, ADHD, thyroid disease, migraines, heart disease, diabetes, obesity, and drug or alcohol abuse. Many sufferers attempt to use drugs or alcohol to self-medicate during the manic or depressive episodes. It has not yet conclusively been determined what causes BPD, but there are various treatment options available to patients. My Latin is terrible, but some of the psychiatrists can prescribe lithium, valproic acid, lamictal, olanzapine, aripiprazole, quetiapine, and other antipsychotic and antidepressive medications. But these, like all medications, come with severe to mild side effects. Some of the side effects include dry mouth, acne, bloating, indigestion, drowsiness, dizziness, flu-like symptoms, and joint pain, which are very common. More severe side effects are tardive dyskinesia, which is when a patient has too much of the particular medication and they start to develop unwanted and uncontrollable movements around the mouth, which usually is stopped as soon as treatment is stopped, so as soon as they stop taking that medication. But on a few occasions, tardive dyskinesia has been permanent. And the most severe side effect is ironically suicide. It's been shown that Oftentimes, when a patient suddenly stops treatment, that they have increased suicidal tendencies. There are other treatments such as electroconvulsive therapy, which is shock therapy, so they sit you down and they shock you, for patients who react unfavorably to traditional medicine. And because this treatment is incurable, many people are seeking alternative types of treatments. Nancy Petrosky, author of Najal's Encyclopedia of Social Science, explains that recent research reveals that diet and structure play an extremely important role in controlling symptoms and lengthening the time in between episodes. It must be made clear that all of these treatments must be used in conjunction with medication, not as a substitute for it. Burgess states that avoiding sugar and excessive starch, which converts into sugar, helps to control some of the manic episodes. It is recommended that patients start their day with 25 to 55 grams of protein because this seems to act as a stabilizer throughout the day to, again, control some of those symptoms. In terms of behavior, structure has been shown to help immensely. Deep breathing and meditation also helps to control some of those episodes. But all these help. They do not cure this disease. This disease, which has been called one of the greatest scourges of our time, I'm not concerned with what's going to happen when I'm 30. Do you know what life's like after 30? I don't, because I'm never going to make it to 30. I don't want that. Kurt Cobain, 1967 to 1994. If this is the case, how is it that some of the greatest artistes in the world not only have bipolar disorder, but continue to produce important work in spite of it? The entertainment gossip magazines are to be believed. Robin Williams has unsuccessfully battled alcoholism for years. But despite this, he continues to be one of the greatest comedians of our time. One can almost see the manic episodes in his brilliant performances. Had he been mentally stable, would he have been as funny? You have to ask the same question of Jim Carrey. Edgar Allan Poe is one of the most acclaimed and prolific poets of our time. Could he have been as brilliant had he been normal? One could argue that he might have been able to finish some of his unfinished work, but would it have been as good? Would the Raven have been the Raven had he been more on lithium and more stable in his moods? At the end of the day, how one views bipolar disorder is extremely subjective and personal. There are those who view their bipolar disorder as personal motivation to succeed in spite of it. There are others like Kurt Cobain who seem to accept it and eventually took his own life because of it. Like most things in life, you get out of it what you put into it.